I have the honor to thank Professor Wael Bahbah and Professor Muhammad Zannoun for the extremely extensive work all over 1 year to let such conference unforgettable. I am delighted that the International Pediatric Association, headed by its President Errol Alden, is among us here in the first row. And I am delighted to introduce my colleague, Professor Tariq Al-Walili. He is a maestro of the scientific activities in our department in Alexandria University and creating a pediatric club in our university. So he will give us a presentation with the name of a projection 20 years ago or more, The Good, Bad and Ugly, Fever, Pain and Inflammation, the Challenge.
بسم الله الرحمن الرحيم والصلاة والسلام على سيد المرسلين. بادئ ذي بدء. Excuse me to speak some a little bit in Arabic. I'd like to thank Dr. Wael Bahbah, Dr. Muhammad Zannoun for the great effort of this PEDIA Egypt conference, and welcome you all here as welcome guest speakers in Egypt, Cairo, and welcome you of course in Alexandria. That's our hospital, should be University Children's Hospital, just like the castle there, to defend Alexandria and their children. That's me, Dr. Tariq Al-Walili, Professor of Pediatrics at Alexandria University. Our talk, of course, not so deep in scientific field, but a practice of every day about fever, pain, and inflammation. If you could remember this movie, The Good, the Bad, and the Ugly, in the 1966, introduced by Clint Eastwood, Van Cleef, Eli Wallach. It's kind of Italian movie over the Western, and specified the good, the bad, and the ugly. So in our practice, really, the good, bad, and the ugly is fever, pain, and inflammation. Of course, because fever is not bad all the time. It is a good. It's like kind of enhancing the immune system of the body to help fighting against microorganisms. Pain, of course, it's the bad part. It's suffering of the children of this particular time, and the inflammation is the bad thing. So the good, bad, and the ugly is our theme to call about. Fever in pediatric practice are very common. Every day you can see cases of fever. And fever, it's a hot topic everywhere, anywhere. If you could remember this movie, 1959, by Marilyn Monroe, Tony Curtis, and Jack Lemmon, about some like it hot. But it's not the case all the time, because, of course, we are pediatricians, some hate it hot. If we return back to the meaning of the fever itself, it's kind of pyrexia, comes from a Latin word pyritus, or fever from the Latin English or Old English fever, or in Francais fever. So fever is an old term to be used to describe fever. This one, Abu Ali Al-Hussein ibn Abdullah ibn Sina, one of the famous Arabic scientists, who first distinguished between the fever as a sign, not as a disease, not as a curse as before thought by the medieval ages. So this is a start point to know what's fever. And the first one to describe fever and make a temperature chart for that was Karl Reinhold August Wildlerich, the German physician, who just started to design the temperature charts and use a very primitive thermometer. It's 1 feet long and has to take the temperature in 20 minutes. You could imagine in our practice if you take a temperature in 20 minutes. Most of the time, many people thought of fever phobia. They are afraid of where children being febrile, it may affect the brain, the statistics say that at least a third of the parents think if the temperature above 39 it will cause damage to the brain. 2/3 of them think if there's something serious with the fever, more than 40, it will damage the brain. And of course, all the parents will think the fever above 31 will destroy the brain. So that's the fever phobia everywhere. In the medieval ages, they said that it's a curse, it's a pre-mortal, it's a marker of death. But in the old Islamic medicine, they start to think of fever as a disease, as a part of a disease, and try to help by the use of herbs or some medication primitive like this. Of course, feeding associated with fever are called a lot of taboos that considered that don't drink milk, don't eat eggs. Of course, it's nonsense to call that, because some people may use egg white to help control temperature. Of course, a specific food is not related to fever anymore, because some people think of it. If you take some sort of food, and this cartoon said, "Dear, you have fever, I'll make a chicken soup for that." So the guy will reply from the chicken, "No, please use paracetamol." No need for disgusting food to treat fever. Along the line, they can try to use some home remedies to try to reduce the fever. Of course, they can bring the turmeric powder, the ginger, the mint, and sometimes you could showering, except water. It's acceptable, but not the logic line of management. Coming to fever treatment, we could treat. The American family physicians stated evaluation and infant young children for fever. They discussed it and they put the guideline for that. They tried to direct their message even to the parents in an illustrated form, how to manage, how to use the antibiotics in the treatment fever and proper dose, proper duration. So management fever, the part R, part sign. For the general management of fever, you have to take sufficient intake of food, at least avoid stressful conditions, no need for absolute rest, no need for overwrapping and a lot of clothing, but live in a good temperature to health. That's the general measure. For the medical treatment, the antibiotic use, not need to use it regularly, not use necessarily in prophylactic way, just to avoid using it so frequently to avoid the side effects, only in cases of patient who is susceptible to febrile convulsions. The use of antibiotics, there is no evidence to support one over the other. Just use whatever is available to control the temperature of your baby. No route is preferable than the others, because the parents or the mother especially think that the substitutory will help to reduce temperature more, but there is no evidence that any kind of rule or way of delivery will affect the condition. Of course, several studies have shown that many parents even not use it properly, not given the proper dose, not given the antibiotic before coming to the physician to see their patients. Speaking about the acetaminophen, the paracetamol, you have to use it properly in a proper dose, from 10 to 15 milligrams per kilogram per dose, up to 5 times per day. There's no different effectiveness based on the route of administration whatsoever. The same with ibuprofen. You have to do proper use of 10 milligrams per kilogram per dose, up to 3 times benefit. There is no just benefit difference between both of them. So the ibuprofen works upon the cyclooxygenase, and of course it inhibits the production of prostaglandin to control, so this is COX-2 inhibitor. Coming to the evidence-based medicine, so you have to signify your prescription, your indication by evidence. 17 randomized controlled trials signifying the presence between the ibuprofen and the paracetamol. There is no much difference, just the ibuprofen maybe start to work earlier and for a longer time, but there is no difference between both of them. In a lot of literature discussing the ibuprofen and the paracetamol, the treatment for all children, randomized controlled trial, there is found no difference specifically between the two products. That's mentioned in the British Medical Journal. And another study about the economic evaluation, because if you use both of them, it's a lot of burden on the economy of the parents, of the family, even on the government. The American Family Physician mentioned that in their report, there is no difference between both conditions, both safe to be used, no need to combine both of them or to use them alternatively. In the pediatrics, recently, I'm certain it's not recent, of course, but a little bit, 2011, just mentioned the spectrum of antibiotic to be used, just to mention with them the paracetamol, ibuprofen, drug choice, and the diclofenac also. Talking about diclofenac, it's a preparation used, mentioned to be with treat fever associated with common infections. So diclofenac is a non-steroidal anti-inflammatory, not mentioned too much as an antibiotic, used as an anti-inflammatory and neglected as used as antibiotic, have to be mentioned. This has effect on controlling temperature. It's one of the most common off-label use of medication outside the known information of the drug, so it's used as antibiotic also. So it is decrease the pain score, decrease the opioid requirements, and reduce the paracetamol requirements. Depending upon the dose, it's too much studies about the proper dose from 0.5 milligram per kilogram per dose up to 2.5 milligram. Acceptable 0.5 to 1 milligram per kilogram per dose. So describe it in the proper dose. For this clinical drug investigations, mentioned that lowest effective single dose of diclofenac for antibiotic analgesic effect in acute febrile conditions, just to compare between doses of paracetamol and placebo, and of course find that there is a good significant change of the temperature of the patient with diclofenac more than paracetamol, and of course more than the placebo, and that's a significant difference between both of them. It's a recent study in the Iranian Red Cross Medical Group talking about rectal diclofenac versus rectal paracetamol comparison of antibiotic effective in children. It just published 2016. Of course, it depends upon the single dose controlling the temperature with this medication. This is a study about efficacy of diclofenac potassium versus acetaminophen in febrile children with acute upper respiratory tract infections. And it's mentioned or published 2012 about the efficacy and give a significant difference for the diclofenac as antibiotic over the paracetamol or ferritin. So in this study, it's a multi-center sample and trial on 300 patients. They found that diclofenac gave a response within short time, within 20 minutes, to decrease the temperature over the ibuprofen, of course, over the nimesulide, which is not used in the pediatric anymore. So that's the history. That's a start point from 1963 up to now to use as antibiotic. There is other types recent of fever, that's Facebook fever, and we are coming to the next one, who is spring fever. We are coming to spring recently. So we have to imagine what's the difference. The second part is the pain. Of course, pain is not much appreciated by pediatricians, as they consider children not suffering from pain anymore, because they are not sensitive to pain, especially in the very young age group. And to consider circumcision was a traumatic experience for the children if it is done very early in the neonatal period will not fail, which is not true all the time. And of course, dealing with medication for pain regulation or pain treatment is not mentioned so much in pediatric practice because they think that's a form of addiction would occur to the patient or the children if they use frequent analgesic effect. It's so difficult to check for pain in children because there is lower verbal fluency. We couldn't cooperate with patients to give the chance to express themselves about the pain feelings. So a lot of expression faced by our kids when they are suffering from pain. They try to make a lot of scales for assessing the pain for children in different ways, according to the smiling face, or trying for the baby to give a chance, even in the Lego form as a kind of toy, or using the one-packer spectrum with this pain could be ignored, or severe interfered with basic activity of the children, or they couldn't scale according to the color, according to teddy bear smiley faces, or this at least to give a chance for the pediatrician to know what's painful. OSHA 1 is kind. So the problem of pain control was from very early years, but of course they use alcohol, ether, nothing directly to interfere with pain. For the pain management, a lot of things, even the physical parts. The physical parts means acupuncture, massage, learn and play activity, using medication as acetaminophen, ibuprofen, ketorolac, or even the morphine, the opiate derivatives that we use in children. Of course, we don't use morphine only in cases of congenital heart disease with synaptic spells. A lot of pain medication be used. This study on the Cochrane, or the evidence-based direct diclofenac for pain relief in children, especially those post-operative after circumcision, but of course they are not circumcised, their children, in the first year of life. So diclofenac considered an analgesic, and this study showed that will affect diclofenac with amoxicillin compared to amoxicillin with placebo. This will reduce the pain within 20 to 30 minutes. So diclofenac is a good analgesic effect. A lot of trade names used all over the world. I searched for them a lot and a lot. There are more than 115 kind of medication used. So it's commonly in use all over the world to use the diclofenac as analgesic and antibiotic. The last part is inflammation. So inflammation is a very important reaction inside the body. It's a kind as a macro circulation level with the tissue damage, cellular and vascular reaction with response, and metabolic changes and tissue repair. It's a kind of self-defense mechanism for the body to diminish the inflammatory reaction. And of course, it gives us the 5 pillars of hotness, redness, swelling, and pain, and loss of range of movement. So if we like to control this condition, non-steroidal anti-inflammatory will share or take a good share of this experience of controlling. Of course, the major pathway is kind of cyclooxygenase to stop the prostaglandin in essences. And if we go through this, we are talking about COX-1, cyclooxygenase 1 or 2, and the cyclooxygenase pathway to stop secretion of prostaglandin. So mediators derived from arachidonic acid and SAS during the action. If we see this diagram, this is a stimulus. Okay, sorry. Going quickly through this algorithm, the cascade of stimulus reaching to the end stage with inflammatory reaction. If we like to go through the cascade, we have to stop it with medications. So as a condition of starting phospholipase inhibitor as a corticosteroid with the main anti-inflammatory action, up to non-steroidal anti-inflammatory acetylsalicylic acid that cyclooxygenase inhibitors. All of these conditions reaching to the end to stop the medication. So we are faced by fever, pain, and inflammation, 3 intermingled conditions. We have to deal with them, all of them, in a one-way effect. So if you're talking about using of antibiotic, analgesic, anti-inflammatory, so we are need a soon drug to be dealing with the 3 problems together. And I think diclofenac in the form of catafly will help to reduce fever, inflammation, and pain, and give us a good solution for that. If you could remember this movie, Saturday Night Fever, most of the parents suffering from this problem or taking the weekend as a start point I'm talking about Saturday night fever. Here in Egypt, we have to talk about Thursday night fever because the parents usually complaining in the weekend that their babies will suffer from fever, pain, and inflammation at that particular part. And that's coming soon. Those kids are hot. You remember Snow White and the Seven Dwarfs? Of course, the sneezy one died, not because of the symptom, the sneezing, but from the disease behind. So here's the message: don't just treat the fever or pain and inflammation alone, but just consider the cause, who give the fever the chance, and don't forget to deal with that problem. Lastly, I'm from Alexandria. Welcome you all to visit Alexandria with us. We are preparing for our PEDIA Alex conference from 25 to 27 of July 2019. Thanks a lot. If any question, you are welcome. Thank you very much.
Thank you, Professor Tarek El-Weleili, for this nice and elegant presentation regarding the fever and the pain and the inflammation. And now we'll open for discussion. For the three speakers.
One. كويس كده كفايه.
اوكي.
شكرا جزيلا، شكرا لكم كلكم، وشكرا خاص للدكتور محمد زنون والدكتور وائل بحبح على الهوسبيتاليتي، على الجود بريبريشن. الحقيقه very magnificent, very nice experience to be with you, to be with our international guest speakers. Thanks a lot.